The reason why I've chosen to work within a hospice is I found my love for end-of-life care. I find it an absolute honour, pleasure to be able to be with somebody in their most vulnerable point of their life, to be able to give them that comfort, that compassion, that dignity and respect that I think every human being deserves. There's lots of pressures, lots of challenges now ahead of us with COVID-19. The way that we deliver our care and our support to families has had to change because of the pandemic. We have to now go in obviously with all of our PPE on, so it's not quite so personal now going in. Like, give that touch, that cuddle of comfort to patients and their families. We're having to try and make sure families don't have too many family members in the home to protect us. So having to ask family to step aside is quite, it's not a very nice thing to have to do, to ask family to do that. But we're still doing it to a high standard and allowing people, our hospice, to have people die at home, which is at the moment so important, because if they were to go into a hospital or hospice, they're very limited to the amount of people that can be at their bedside. At least being at home now, people can have their wife, their husband, their daughter, son, whoever beside them 24/7 in their own environment, which is really important. We're seeing a lot more people and they're not with us as long as they would be normally, where we would have patients on our whiteboard for, say 40 days. We're lucky sometimes to have our patients with us for 2-3 days at the moment. And going forward, I think where people haven't been able to have their treatment for their illnesses, we're going to see a lot more patients come through our service. If we are well supported, we're then able to reflect that onto our patients and their families. So if we are able to express how we're feeling and have the support in dealing with the certain ways that we do feel, we can then go into our patients feeling happy, feeling upbeat, because we're supported in the background. So then that reflects on them. So they always have a nice, happy, smiley face under our masks. They can see it through our eyes. We always tell our patients and their families that we're smiling under our masks. And it lightens the mood. We joke and we laugh with them. We don't go in all doom and gloom. It's about being as upbeat as possible, making this awful experience as pleasant as it can be with the families and the patient. It's just a wonderful job. People may not understand that, but it really is truly a wonderful job, and I'm honoured to be able to do it.